Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's body chat about acupuncture and dry needling, a new drug-free way to poke your pain away. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen into our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good evening, Steve.
Good evening, Ron.
So today we're going to be talking about an interesting topic. Let's start out with getting some information on acupuncture, because that's been around for a very long time. So when did it begin being used, and where did it originate?
Well, it's generally believed that acupuncture began approximately 5,000 years ago in China and other Asian nations. Metal needles made from copper, but not necessarily acupuncture needles, date back as far as 6,000 years ago. And there's other forms of needles that have been excavated from ancient times, including bronze, jade, stone, and bamboo.
Okay, good. And then what are the basic principles behind acupuncture?
Well, traditional Chinese acupuncture developed over 2,500 years ago. There are 12 primary and 8 secondary invisible energy channels in the body called meridians.
Mm-hmm.
And they make up at least 2,000 points, of which there's about 400 that are commonly used.
Okay.
And also there's points on the ears.
Okay.
Now, traditional Chinese acupuncture is governed by what they call universal laws, but they are, in fact, human-formed historical concepts, not natural laws.
Mm-hmm.
So these so-called laws are really observations and theories that are based on Chinese agricultural civilization and philosophy.
Okay.
And the 3 primary laws of traditional Chinese medicine are yin-yang, the 5 elements interrelationship of earth, wind, water, metal, and wood, of which they observe their agricultural environment, and qi, the so-called vitality or energy that exists in every entity.
Okay, good. So then tell us about what the yin-yang is.
The yin-yang is very interesting. It basically has to do with everything has an opposite to it. Mm-hmm. Male, female, black and white, and so forth. And it has to do with balance. And so when you do acupuncture, you're trying to restore balance in the body. And that is the common theme among the 3 different Chinese laws is balance. So it's thought that the stimulating the various acupuncture points helps to restore balance in the body by normalizing meridian energy and flow.
Okay.
So for example, a point might have too much concentrated energy or not enough energy. So it's thought that stimulating that point with a needle helps to either disperse too much energy in the area or draw energy to it if there isn't enough.
Okay.
And the same can be said about overall meridian energy flow. The meridians are likened to a river, and if there's not enough flow, it's like a blockage or being dammed up. So specific points are needled to restore this flow.
Mm-hmm.
And likewise, if there's too much flow, like when a dam breaks, the flow can be slowed down to restore balance again too.
Okay, so we're basically talking about energy channels in the body and the energy flowing through them and balancing that out.
That's right.
Okay.
And these channels are all interrelated. So sometimes needling points on one meridian can affect the flow of balance on another.
Okay.
And in addition, many points have specific effects on totally unrelated and distant parts of the body. So a great example is large intestine 4, which is located on the web between the thumb and the index finger.
Mm-hmm.
And this is the most needled point on the human body, and it's especially helpful for all conditions relating to the head and especially headaches. And another interesting piece of data about this point is that it should never be used during a woman's pregnancy.
Mm.
It's one of several what are called forbidden points because it, along with spleen 6, which is found on the inside of the lower leg, could actually cause early contractions. And there are some cases where it potentially was responsible for a spontaneous abortion or miscarriage.
Interesting.
Yeah. Mm-hmm.
I used that on a classmate at chiropractic college. She was past her due date, and she was doing things like jumping on rebounders and trying to take long walks. She wanted that baby to come out so bad. And so we were in one of the classrooms. I can't remember. It was one of the lab classrooms where we worked on each other. And they had one of those screens like you see at a medical office or a hospital. And we just got a table behind there, put the screen up, and I got some acupuncture needles out. And I did large intestine 4 and spleen 6, the 2 points you were talking about. Because she wanted so badly to have that baby come out. So we did that, and she actually started having contractions. And the contractions went on for a period of time, and then they stopped. And she was just frustrated. Anyway, she finally did have the baby. She went through an osteopath who helped deliver the baby, and it turned out the baby was a breech. It was basically butt first instead of head first. And so what I got from that was that having the baby at that point was not possible. So even though these started the contractions, because the body knew that it couldn't finish what it needed to do, it just stopped the contractions. So it was interesting because those points will actually do that. I know that from personal experience.
Yeah, and while you're on the subject of breech, there's actually a point on the end point of the little toe on the outside that is outstanding for breech presentation. It has up to a 90% success rate for that.
That's great.
And so I've helped some people turn their babies around doing that.
Okay.
Yeah.
What is the difference between acupuncture and acupressure?
Well, that's a great question. Acupuncture is the insertion of sterile, disposable stainless steel needles that are typically about 1/5 to 1/10 the diameter of a hypodermic needle. They're almost as thin as your hair, and they're anywhere from 1/2 inch to 6 inches long. And, they're used on acupuncture points or areas of pain or injury and can be inserted through the skin to a depth of just a couple millimeters to as deep as 6 inches. The longest needles that I use are 3 inches, and I typically only use them in the gluteal area for low back pain, sciatica, and hip pain.
So what is the gluteal area?
Your buttock, as Forrest Gump would say.
Okay, good.
Yeah, and acupressure is the use of finger pressure instead of needles on the same points.
Okay.
And the most common is thumb pressure, also known as shiatsu.
All right.
Now, the effects of acupuncture are generally more profound than acupressure, but the advantage of acupressure over acupuncture is that it can be used on someone who is needle phobic. And it can also be part of a self-treatment program. For example, if a woman is needing help with inducing labor because she's at or past her due date, then in addition to having the 2 points needled, the ones that we just discussed, the large intestine 4 and spleen 6, the expectant mother can also stimulate these points herself or have a relative or friend do so to help produce contractions as a follow-up to her acupuncture treatment.
Excellent.
Yeah.
All right, good. So then other than the things we've discussed having to do with labor and breech presentation by a baby, what are some of the conditions that you've seen improve after balancing meridians using acupuncture?
Well, the list is pretty long, but I'll give you the most common ones and the most miraculous ones I've been very fortunate to witness as well as experience myself.
Okay.
So the common ones would be things like back pain, neck pain, shoulder pain, headaches, including migraines, sciatica, hip pain, elbow pain, wrist pain, knee pain, ankle pain, fractures, sprained ligaments, muscle tears, sinus congestion, TMJ disorders, eye problems, including twitching and glaucoma, Bell's palsy, which is also known as facial paralysis on one side of the face, and shingles.
Okay, and those are all ones that you've actually seen improve when you had meridian balancing being done through acupuncture, acupressure, right?
That's right.
Okay.
And then some of the miracles are, well, the first one was my own success story when I was still in high school. I was in my last event, my last track event, I was anchoring the 400-meter relay. It was districts, and there were 8 teams, and our team was in 7th when I got the baton. And I got a really good exchange. It was clean, and I caught 3 guys immediately, so I was in 4th place, and I was gaining on 3rd, and we were in the home stretch, and all of a sudden, bam, felt like somebody shot me in the back of my leg. I pulled my hamstring. It bruised up. I mean, I hopped the rest of the way. I rolled off into the grass. I mean, the pain was just unbelievable. And so what I did was there was a fiber of the muscle that literally tore and rolled up like a window shade. Pretty nasty.
Mm-hmm.
So what I remember is the long drive from there all the way down to Ashland, which is where our ex-brother-in-law was.
Mm-hmm.
And he and another sports doctor did acupuncture on it.
Mm-hmm.
And I remember that, I was able to sleep through the night, and he did another one the next day, and I was almost pretty much out of pain. It was just miraculous.
Mm-hmm.
And after about a week, I was walking around without any crutches, without pain. And then a month later, I was running on it.
That's great.
So then I decided at that point, I said, well, I think I'm going to do more than just chiropractic when I get in practice.
Right.
Now, another sports injury with acupuncture was a friend of mine who was a fellow bowler.
Mm-hmm.
And I remember I was at my old practice in Fort Myers, and it was a Wednesday. And I didn't work on Wednesdays. I worked Monday, Tuesday, Thursday, and Friday. And I happened to be in the office just doing some work. And he came in and he showed me his thumb. And he was a carpenter, and he had a little mishap with a tool, and it went right through his thumb.
Was that Ed?
No.
Okay.
No. And so he had to go to the hospital, and they had to surgically reattach a tendon and repair an artery that was damaged. I mean, it was huge, swollen, and he was bandaged and all this. And they said that he was likely not going to be able to bowl for 3 months because that was actually his bowling thumb.
Wow.
And I said, you know what? I think I could speed that up. Let's try this. So remember the old acupuncture technique called surround the dragon?
Mm-hmm.
Where you take 4 needles and you surround an area of injury. And so what I did is I did that, and I added electrical stim to it.
Okay.
And I treated it for about 20 minutes. And then I taped magnets on either side to help draw energy into the area. And I told him, come back in a day or two and tell me how it's doing.
Mm-hmm.
So I remember I was at work the next day, and he came in and he popped over and he showed me real quickly. He said, I took the bandage off. The pain is gone. The swelling is gone, and I'm moving it normally. It's unbelievable.
Wow.
Great. I said, come back another time so I can really take a good look at it. So that was on a Thursday, right?
Mm-hmm.
So the following Tuesday, that's when we had bowling night.
Mm.
And he's out there throwing bowling balls.
Wow.
And I'm like, what are you doing? He goes, oh, man, I was bowling 2 days ago on Sunday. Are you kidding me? This thing's totally healed. And I said, I really don't recommend this. And he goes, no, it's fine. And so anyway, the following Saturday, we were in a tournament together. And he won for the highest score. He bowled a 290, he had a spare, and then 11 strikes in a row.
Wow.
That thumb. I mean, there's some things you just can't explain scientifically,
Excellent.
So that was cool. And then the final one is probably the biggest miracle I've witnessed with acupuncture. And that is I had a patient her sister was a patient of mine, a massage therapist from Naples. And she called me up and said, listen, my sister had a bad accident. She had a mishap with a boyfriend, and there was a gun involved, and then she got shot accidentally and it lodged in her chest, and she's now paraplegic. She has no feeling from her chest down. And she's in Chicago. And I go, well, it just so happens that my mentor is up there, and he's helped people that were paraplegic and quadriplegic. So
is that Sunderledge?
That was Dr. Sunderledge.
Yep.
So she was in the hospital, and this was in December. And as you know, the weather in Chicago can be pretty nasty. And so he drove across town in a blizzard.
Wow.
And then came to see her, and he did what's called a pulse diagnosis and checked her out real closely. And he said, yeah, you'll be walking in 6 to 9 months. She's looking at him like, are you crazy? I'm going to be like this the rest of my life. And he goes, nah, I'm never wrong. So he said, as soon as you get out, come see me. So she did the following month in January, and he did one treatment on her. He said, listen, you need to get away from all the stress and the bad weather. Go down and stay with your sister and my protege, Dr. Nedd. I'll send him the protocol.
Mm-hmm.
And so he did. And then I did, her whole spine needles. There were times where I was doing 100 needles at a time per treatment.
Wow.
And I hooked her up to the electrical stim and everything. And after each treatment, something positive would happen.
Mm-hmm.
And I remember that was back in the mid-90s. So we really didn't have cell phones back then. We had pagers.
Right.
And so, I remember I was actually visiting you up in Clearwater, and I got a page from them, and I had to, you had to go and call this number and listen to the message. So I listened to the message, and she and her sister are going crazy. Oh my God, I can contract my hamstring, and I can tell when I can go to the bathroom. And I mean, it was amazing, right?
Wow.
Yeah. So then they decided that she was going to try to walk and stand up. So she knew somebody in Chicago who worked at a prosthetic store, and she wanted to be fit for braces. So she went up there, and she went on a Monday, and she had a virus. She wasn't feeling well. She was real weak and tired, and decided not to do it that day, and then came back at the end of the week. And the technician working with her basically said flat out, she says, "What are you doing? You're a paraplegic. You can't walk." And so she goes, "Get the heck out of my way." She lifted herself up by herself, took a step forward, step backward, sat down. And he goes, "Okay, I'm sorry, my bad." And so what's cool about that is her sister, who was a massage therapist, went on to become an Oriental medicine doctor and specialized in paraplegics and quadriplegics as a result of that.
That's a great story.
Yeah.
Cool. So now we've learned about acupuncture, what it can do. So what is dry needling?
Well, dry needling is an offshoot of acupuncture, and according to my mentor, Dr. Ma, the founder of Integrative Dry Needling and the author of Dr. Ma's Neurologic Dry Needling, it's more of a highly effective form of physical therapy than it is acupuncture.
Okay.
It does involve the insertion of an acupuncture needle through the skin, and it tends to go into the deeper tissues that are considered trigger points to your pain. And it works by causing a small area of irritation within malfunctioning or injured tissue to help break up things like muscle knots or scars. And it also helps to stop painful reflexes from the nervous system to the tissues being treated, just like the broken record discussion we had in an earlier podcast when talking about the benefits of a chiropractic adjustment.
Right.
And, it also reduces and normalizes inflammation and basically creates an environment that enhances the body's ability to heal, which ultimately reduces pain.
Okay.
Yeah, and like acupuncture, it also helps the body produce its natural painkillers called endorphins.
Makes sense.
Now, the reason it's called dry needling is because there's other similar approaches which use liquid injections to treat trigger points and block nerve pain. And those include lidocaine, which is a local anesthetic drug that can be injected into the tissue, cortisone, of course. Now, some studies show that dry needling gets similar results to these other approaches without any side effects, and it's considerably less expensive at around $40 to $85 a treatment.
Okay. So then what are the differences between dry needling and acupuncture?
Well, the biggest difference is that dry needling is continuously evolving with medical advancements in the basic sciences, since it's based on the laws of modern medicine. Whereas traditional Chinese acupuncture is based on the laws, or rather theories, of traditional Chinese medicine, which we covered earlier.
Okay.
And these are human form concepts, not natural laws, since they don't obey scientific laws. Despite their differences, though, research shows that both dry needling and acupuncture both work.
Okay.
Dry needling also focuses on needling specific points, just like in acupuncture, and these are called trigger points. Believe it or not, 80% of the trigger points also happen to be acupuncture points.
That would make sense.
Yeah. But dry needling also handles points that are distant from trigger points. And what they do is they follow nerve lines, and this essentially makes dry needling additionally an effective nerve pain reduction therapy.
Okay.
So an example of this is an evaluation that we're taught in dry needling, where we touch certain points along nerves, and by seeing which ones are tender, we can predict the amount of time it's probably going to take to get this person well, the number of treatments and things of that sort.
Okay.
So it's a much simpler, easy to learn approach of analysis than, let's say, like the pulse diagnosis used in acupuncture, which takes many, many years to master.
Right.
Now, one more thing that does distinguish dry needling from traditional Chinese acupuncture is the various needle manipulation techniques. So, for example, there's this thing called pistoning, where the needle is manipulated very quickly like a piston to create like a twitch response, a muscle twitch response. And the big reason I got into dry needling is because of this. I had my third shoulder surgery, and I had a lot of scar tissue and knots in my muscles. I was just miserable. And I actually went to a doctor who did dry needling, and he did this technique on me, and it gave me more relief than anything.
Okay.
And one of the other things that he did, and another type of needle manipulation, is called needle rotation, where you literally wind the soft tissue around the needle.
Mm-hmm.
And then you do what's called tenting, which is after you rotate it, you pull the needle away from the skin to create the lifting of the soft tissue that looks like a tent. And this is especially good for scar tissue and tingling in the extremities. So the scar tissue in my area just kind of let go when he did that.
Okay. Good.
Yeah.
When would you use dry needling and when would you use acupuncture?
Well, that's a good question because I basically combine them both now.
Okay.
I use dry needling mostly for pain syndromes that I treat. But I also use acupuncture protocols for specific things like quitting smoking, bruises, healing fractures, eye conditions, and labor inducement.
Okay.
Yeah.
That makes sense.
Mm-hmm.
Now, what kind of training and or certification was involved to be able to use acupuncture in your practice?
Well, I'm actually board certified in acupuncture as opposed to board licensed, which involves getting a degree other than chiropractic or medicine. So the certification is sort of like a tag on to my licensure as a chiropractic physician.
Okay.
And it's required that you have at least 100 hours of specific training in acupuncture and passing of a state board exam to practice it in Florida. I attained this in 1990 as part of my Florida chiropractic board exam.
Okay, good.
Yeah. I now have over 200 hours of training in acupuncture, and I have the status of fellow, which is above the basic certification status, but is not as prestigious as diplomate, which I may do in the future. Yeah.
All right, good.
Mm-hmm.
And what kind of training or certification was needed to use dry needling?
Well, I did the foundation course for integrative dry needling, which covers pain management and sports rehab. And it's about 27 hours long over 3 days with intensive learning, lectures, and hands-on labs where we actually needle each other. And I took this last year and I plan on doing a refresher course this year. And then in the future, the advanced course for pain management and human performance.
Great.
Each level includes written and practical exams for certification. And one other thing I'd like to share is that Florida is one of the only states that doesn't allow physical therapists to practice dry needling since it classifies it as acupuncture and not physical therapy. Physical therapists in Florida are not allowed to puncture the skin.
Oh, okay.
So technically, even though it's really a physical therapy, I have to call it acupuncture when I perform it in Florida.
All right, that makes sense.
Yeah.
All right. Now, if somebody wants more info on acupuncture or dry needling, where can they get it?
I mean, there's many great books on Amazon.com and great articles you can search for on the internet, but books that I have actually read that give the basics are both available now from Amazon.com, and they are The Healing Benefits of Acupressure, Acupuncture Without Needles by F.M. Houston, D.C., and Acupuncture, The Ancient Chinese Art of Healing and How It Works Scientifically by Felix Mann.
Okay.
Unless you're going to practice dry needling, there aren't any specific books I would recommend, but the Wikipedia page for dry needling is pretty decent, as well as the one for acupuncture.
Okay.
And you can also find some data on each on our website at neddchiro.com.
Okay, great.
Yeah.
So I'll have to get all the various different links that are going to be going into the podcast notes for all these things that were brought up.
Mm-hmm.
And that all sounds good. So is there anything else you'd like to say before we end?
Yeah, I realize some of you may not hear this until after February 22nd, but at 6:30 p.m. that evening, right next door to my office at the meeting room for Nature's Food Patch called the Patchworks Community Room, I'll be giving a free seminar on dry needling.
Excellent. All right, good. So people should plan on attending. Go and get your dried nuts and fruits and things like that over at Nature's and have a snack so you can sit there and listen to the dry needling workshop by Dr. Stephen Nedd.
Yeah, I'm going to include a live demonstration and make sure you bring your friends and family and come early since space is limited.
Excellent. All right. Thanks again, Steve. Next week, we are going to be talking about a different topic, and that topic is going to be carpal tunnel, a traffic jam for nerves.
There you go.
So if you've ever been in a traffic jam and you want to know what that has to do with carpal tunnel, come and find out. And between now and then, we'll figure out what that is and tell you about it.
Okay.
All right. Thanks, Steve.
Thank you.
Thanks for joining us this week on the Body Chat Podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week, and if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. Next week, we're going to chat about the carpal tunnel, a traffic jam for nerves. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat Podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.